Welcome to Clara Compliance Chronicles.
Okay, so we're diving into a big one today. Controlled drug management in UK healthcare. We've got a ton of government documents to get through.
Think of this as your cheat sheet.
Exactly. We're talking GP Mythbuster articles. Those are from the Care Quality Commission.
Right.
And then we've got actual UK legislation, too, like the misuse of drugs regulations.
We'll even take a look back
Oh, yeah.
at how record keeping has changed since 2006.
I mean, that 2006 document, that sounds ancient.
You'd be surprised. It's incredible how relevant those changes still are.
Especially with everything going digital now.
Absolutely. Even with electronic records. Those stringent controls from back then,
Yeah.
still as important as ever.
Well, it's not just about Schedule II drugs.
Yeah, right.
It's easy to get caught up in those. You know, the ones that are highest risk, like morphine.
Mm-hmm.
But we've got Schedules 3, 4, and 5, too.
It's a common misconception that all controlled drugs need that highest level of security.
Really?
Oh, yeah. It's a total myth.
Like, give me an example.
Take temazepam. Okay.
It's a Schedule 3 drug, but you still need to store it in a CD cupboard.
Huh.
Just like those higher risk Schedule 2 drugs.
Wow. Okay. Myth busted.
Right.
I have no idea.
Yeah.
See, this is why we do these deep dives. Speaking of things I don't know, what about those home office licenses? I mean, you wouldn't think a GP practice would need one of those, right?
Another common misconception.
Right.
You'd think those were just for, like, big pharmaceutical companies.
Right.
But let's say you have a group of GPs.
Okay.
And they form a consortium to cover out-of-hours services.
Makes sense.
And they're supplying controlled drugs as part of that consortium. They actually need a home office license.
Even if it's just for those late night calls.
Even then.
So it's all about accountability, no matter how big or small the operation is.
Precisely. The regulations are all about having a tight ship.
Makes sense.
No loopholes. They want to prevent any misuse or diversion of these medications.
So it's about preventing those what-if scenarios. Exactly. Making sure everyone's taking their responsibilities seriously.
Staying one step ahead of anyone who might try to exploit the system.
That's the idea.
Okay, so with that in mind,
Mm-hmm.
can you even leave your doctor's bag in your locked car for a few minutes?
Ooh, good question. That's where another myth gets busted.
Seriously?
You'd think a locked car is pretty secure.
Right. I mean...
But,
Yeah.
according to the CQC, it's a no-go.
Really? Not even if you have an alarm system. Tinted windows?
Nope. The guidance is very clear. A locked car is not considered secure enough to store controlled drugs, even for short periods.
Wow.
They recommend a lockable bag or a lockable box,
Makes sense.
and that has to be kept locked, unless you're actively using the medications, of course.
Right, of course. And definitely no leaving it in the car overnight.
Definitely not.
Okay, that's good to know. I think a lot of people would assume a locked car is enough.
It's a common mistake.
So when you're in the practice then, where do you keep your doctor's bag?
You need a designated safe place, away from patients, of course.
Right, obviously.
And that actually brings us to another surprisingly vulnerable element of controlled drug management: prescription forms.
What do you mean?
They're like blank checks,
Oh, right.
just waiting to be snatched.
Yeah. I mean, it's scary how easy it seems to steal them. I think one of the GP Mythbuster articles mentioned someone distracting the staff
Yes.
while someone else swipes blank prescriptions right off the printer.
It happens more often than you'd think.
I bet.
And the consequences, they can be severe, especially with controlled drugs.
Imagine those prescriptions in the wrong hands.
Exactly.
So it's not just about keeping the drugs themselves locked up. It's also about access to those prescription forms, too.
Absolutely.
Secure storage, restricted access, the works.
And it's not enough to just have those measures in place.
What else?
Record keeping is absolutely vital.
Right.
You're talking serial numbers, prescription form movement, who had access and when, why, all of it. It's
Yeah.
a lot.
Like a high-stakes game of Where's Waldo.
Exactly. But instead of finding a guy in a striped shirt.
The stakes are much higher.
Exactly.
And no more sticky notes with passwords on monitors.
Definitely not.
So we're talking about security and record keeping.
Right.
And it makes you think
Yeah.
about all this technology.
Uh-huh.
Electronic records are everywhere now.
True.
But I'm guessing it's not a free pass just because things are digital?
You are right on the money. Going digital doesn't mean you can suddenly slack on security.
Right.
All those principles of controlled drug management, they still apply.
Okay.
You need that clear audit trail.
So the software has to know who's making each entry.
Yes, when they're making it. And it needs to prevent any changes after the fact.
No more going back and changing things.
Nope. Plus, it needs to keep a secure log of all that data for audits.
Okay, so it's like security cameras in the cloud,
Exactly.
making sure everything is above board.
Yes. Makes you think twice before you hit enter.
I bet it does. And this might be another Mythbuster moment.
Okay.
But those times your physical stock and your CD register don't match up.
Yeah.
Those discrepancies, they happen.
Right. They're not uncommon, that's for sure.
Really? I kind of always assume those numbers have to match perfectly.
It happens.
But what happens when they don't? That sounds like a recipe for disaster.
That's where those running balances come in. Remember how we said they were optional but recommended?
Yeah.
They're your best friend when you need to figure out why there's a discrepancy.
Oh, so it's like a breadcrumb trail.
Exactly.
You can see where things might have gone wrong, and then you can figure out what happened.
Precisely. But it's not just enough to notice a discrepancy.
What else do you have to do? Who do you call? Ghostbusters?
Not quite.
I wish.
First, you need to make a note in the CD register itself, stating clearly that there's a discrepancy.
Got it.
Don't try to fix it on the sly.
Right.
Transparency is key here.
Makes sense. Then what?
Then you inform the NHS England Lead Controlled Drugs Accountable Officer.
Wow, that's a mouthful.
Yeah.
There's a specific person who handles all this. What does the CDAO even do?
Think of them as the CD superhero.
Okay.
They have the authority to investigate these discrepancies.
Okay.
And they can even get the police involved if they need to.
Wow. Okay, so they are serious.
They're there to ensure the safety and security of these medications.
Makes sense. I mean, we're talking about preventing these drugs from ending up in the wrong hands, which, speaking of, how do you even dispose of controlled drugs? It's not as easy as just tossing expired pills in the trash, is it?
Definitely not. Expired or unused controlled drugs, still valuable on the black market.
Really?
Oh, yeah. So you don't want to just chuck them in the bin and hope for the best.
So no incinerators in the back of GP practices.
That would make things a bit too exciting.
So what's the procedure then?
First, you have to denature the medications.
Denature.
You're basically making them unusable.
So no chance of someone fishing them out of the bin and trying to reverse engineer them.
Exactly.
That makes sense. But how do you prove you've done it properly?
That's where the witness comes in.
Oh, okay.
You need an authorized witness to watch the destruction.
So I can't ask my buddy from accounting to step in for this one?
Probably not. They need to be independent, not involved in the day-to-day management of the controlled drugs.
Right, I see. Accountability at every step.
Exactly. And then there's one more layer.
Another one.
What else is there?
We're dealing with potentially hazardous substances, so environmental protection is a factor too.
This is starting to feel like a spy thriller.
To legally denature controlled drugs for disposal, you need a special exemption from the Environment Agency.
Of course you do.
It's called a T28 exemption.
A T20 at what now?
Basically, it lets pharmacies and healthcare settings handle this process themselves.
Okay, so it's kind of a shortcut.
It lets them dispose of the drugs without a full waste management license.
Right.
But it still comes with a lot of responsibility. It sounds like it. We've covered so much. Locked car myths, prescription pad heists, environmental exemptions.
It's a lot.
It really is. But how does this actually impact someone working in healthcare every day?
That's a great question.
It really does make you think about the bigger picture.
It's easy to get lost in the weeds.
Right, like just the do's and don'ts. But what does it all really mean?
Yeah.
For people on the front lines of healthcare dealing with this every day.
That's the key takeaway here.
Right.
These regulations aren't about ticking boxes. It's not about avoiding a slap on the wrist.
Yeah.
This is about people, protecting patients, the public, even healthcare professionals themselves.
Right.
It's about understanding even a small mistake with these medications.
Yeah.
It can have huge consequences.
There's that human element again.
Absolutely.
It's not just following rules for the sake of following rules.
Exactly. Imagine a patient. They need their medication,
Yeah.
but because of a record-keeping error, they can't get it.
Oh, wow.
Mm-hmm.
Or what about, like, the wrong dosage?
Exactly. Or even worse, medications ending up in the wrong hands entirely.
Right, because they're controlled for a reason.
That's the whole point of these regulations, to prevent those scenarios. Patient safety above all else.
That's a huge responsibility.
It is.
I can see why that would weigh heavily on people.
It does, and that's why it's so important. Open communication, supportive environment, all of that. It's crucial.
Right.
Doctors, nurses, even the admin staff, they all need to be in the loop. They need to feel comfortable. If they see something, say something.
That's like that old saying.
Exactly. So it's about fostering that culture, accountability, vigilance.
Where everyone feels empowered,
Yeah.
like they can contribute to a safe system.
Exactly. Teamwork. It's essential. These regulations are like a safety net. Everyone plays their part, making sure it's strong enough to catch any mistakes.
Because at the end of the day,
Yeah.
we all want the same thing, the best care for patients, and a system that keeps everyone as safe as possible.
Couldn't have said it better myself.
Well, we've covered a lot of ground today. All those different schedules,
Right.
secure storage, record keeping.
Discrepancies. Don't forget those.
Oh, and those exemptions, that was a whole thing.
That's a lot to keep track of.
It is. And I think the big takeaway is this stuff is important.
It really is.
Controlled drug management, it's complex,
Absolutely.
and we all share the responsibility.
Couldn't agree more.
Well, that about wraps things up for this deep dive into controlled drug management. It's been illuminating, to say the least.
It's been a pleasure.
Until next time, stay curious, everyone.
Thank you for tuning in. Visit getclara.uk to learn more about how Clara, the leading electronic controlled drug register, can help your pharmacy stay compliant and efficient.